I was thinking about what to talk about for just a couple minutes for the private group. And in the show, you were talking about fasting the whole time and the ideal amount of time and duration for the fast. And you were mentioning how during a fast, and this is something I've wondered about and still am digging into all the time myself. And that is, if during a fast, if it has advantages to your clarity of perception and your brain function and cleans out your body and is rejuvenating and refreshing and all these things that have been well established. Mm-hmm. And I guess you could only do 100 push-ups after your water fast, but you said you did much better than that after a juice fast. You did 601, if I remember correctly, right?
On the 6th day of the fast.
Yeah. And so most people can't get too close to 601, even if they're eating 50 pounds of food a day or no food or whatever they're doing. So with all these physical, mental, emotional, and spiritual benefits of fasting, what is the benefit of ending the fast, if any? Or is it just something we're used to, so we have to come back to? I mean, this is a deep question because, in other words, is it possible, theoretically or in history, to change, recalibrate where your body is getting its nutrition away from the physical level so you don't have to be bothered with ending the fast?
So there's a few questions. First of all, we have listeners here, right?
We have a select group of private group listeners. Yeah.
So I just want to say a few things that are going to take us a little bit more technical. Okay.
Sure.
First, when we're fasting, we're turning on the neural-derived hormonal factors that actually rebuild the brain cells.
Okay.
Second, we're actually elevating the growth of new brain cells.
Okay.
Third is we're activating a variety of positive hormonal neurotropic factors. Fourth is, with age, from like 30 years on, roughly speaking, the brain shrinks 0.4% per year.
Right.
Fasting and exercise, but fasting has been shown to reverse that and actually increase brain size.
Wow, that's interesting.
Yeah, it's very interesting. Okay. So we are looking at a few things. I mean, also women who fast have 40% less brain cancer. It's obviously good for healing most of your chronic diseases, like, type 2 diabetes, heart disease, osteoarthritis, and so forth. But beyond that, we are really activating a tremendous amount of hormonal action. That includes increased growth hormone.
Right.
So we have neural growth hormone, so to speak, but also general growth hormone. So fasting is having a certain effect. Now, let's get to your question, which is a very important question. So should we be breatharian? Let's just get to the point. And the question is, does it matter? I'm going to just think about it. Does it matter? And what I mean is, if our point in life is to become liberated,
right?
Do you need to be a breatharian to be liberated? No. In fact, we don't really have a whole lot of evidence of maybe anyone being a breatharian and being liberated. They can be breatharians.
Yeah.
Okay. They can be good yogis. Okay.
Mm-hmm.
I don't know if there's any real, reliable data that says being a breatharian will make you liberated. I don't think that's true. So what if you're just doing water the rest of your life? Well, people can do that. As they learn to take in the cosmic energy through their breath and through their skin and through their consciousness, for sure people can do it. I mean, not a lot of people, but there are people, mostly in India, who have been able to do that. But the real question is, and this is important, you're going to have people who can stay on one leg in a river for, days and days, right?
Yeah.
austerities. Does it make you liberated? Not necessarily. It made me really good for learning how to stand on your leg in a river
Yeah.
and cold water, but does it make you liberated? And my answer is not any more than any other way. So if your point in life is to know God and to be liberated in the, however people see that, but roughly speaking, then these yogic techniques, being a breatharian or, watertarian or whatever, don't really make you liberated. In fact, you often get caught in the technique. Well, I'm a breatharian. You identify with that. I just
Yeah, it's a new ego focus.
That's right. So the truth of the matter is, most people have been, who really become liberated, they do eat very little. Okay.
But they come to some ideal balance, right, between fasting and eating.
Yeah, and I'm going to use the word very little, like Muktananda's guru, Nityananda, Sri Nityananda, he just had a cup of coffee a day or maybe some other minor stuff. Okay, he was, look at him, you look like this big belly. It's like, what is this about? It's called kumbhaka. But the point I'm making is, you want, as you just said, Richard, you come to a balance. So, for me, I don't really eat dinner. I will drink. I'm holding a cup of tea here. Mm-hmm. Okay. I have to keep hydrated. But I'm not eating dinner, and I have just, I eat lunch. And I have a little bit of goji berries in the morning with cacao, and that's it. I'm not eating a whole lot.
Yeah.
I'm not losing weight either. I'm getting stronger.
Yeah, that's a big question that comes up because a lot of people who are demonstrating eating very little, they look emaciated and they're weak.
Right.
And it makes you wonder why.
Well, because they're focusing on not the big picture. So I'm up to 1,200 push-ups every few days. I'm getting stronger.
In what kind of sets?
All at once.
1,200 all at once, full range.
Well, my wife doesn't totally agree with that, but I think it's full range,
Okay.
It's always done for push-ups since I've been 10 years old.
Well, you can tell, yeah. That's a lot of push-ups.
But what's my point? My point is that with, I'm going to say, chronological age, we can get stronger and more flexible. It doesn't really matter what you're eating. I mean, obviously, I eat good food. I don't want to minimize that. I'm saying something a little different.
Okay.
What matters is that, we're getting the perfect nutrition. We don't need a whole lot of it. That's my point. I'm not losing weight. And when I say that, I mean I'm really not losing weight. I may even gain a pound or two, or I do different things, but it's pretty stable. So my point is, your body starts to assimilate more and more from life force, from the energy of the world, and the more you assimilate that, the less you need to eat. But that's not my focus. That's just something that's happening along the way.
Right. I think it's similar to the issue with telomeres, that conventional science sees them as a cause of some kind of aging. And I'm saying they're just one of countless signals of what's happening. They're not causing anything. And I think when you're talking about the food requirements going down, that's just happens naturally. And you're showing that the conventional understanding that you need tons of protein or you can't do any push-ups is not exactly accurate.
Exactly. So the point is that we aren't, we have the potential to go way beyond the norms. Okay. But if you're eating junk food and doing this and that, then you're going to get a way different result than if you're optimizing your intake with optimal food and doing a lot of spiritual work. That there's a kind of progression to that.
So you're saying you're going beyond the norms. The way I've been looking at it is we're trying to find the norms that have been forgotten for a long time.
Well, I would totally agree with what you just said. There is a suggestion that a few million years ago, people were taller and taller. I get that. That's very interesting. I thought they were shorter, but were also longer.
Yeah, and they didn't look, they look stronger. I mean, it's not just that they weighed 2 pounds, but they were really strong. And they looked like you would think you need all this protein and everything to build up. And there are other things that we forgot about.
Yes. So my point is, a warning is you should eat to make, and your strength should be not diminishing, but increasing. 2, your weight should be the same. I mean, once you hit normal, your optimum weight, you see what I'm saying? Sure, you're going to lose weight till you hit your optimum weight, but then it should be stable. And you're on the right track. It's kind of that simple.
I think that's worth a little bit of clarification, because I'm not sure if I've followed it exactly right. When you use the word normal, okay. I mean, I think I don't even have any idea what our normal is yet.
For everybody, it's a little. To me, an optimal weight is where you're going to have optimal strength, optimal flexibility,
endurance,
optimal endurance, optimal clarity of mind. Your optimal energy throughout the day. It's like, I never take a nap. I mean, I don't even think about taking a nap. It's not even a thought. What I'm saying is, everything isn't optimal. Then you pretty much know you've got a diet and a lifestyle that is creating optimal.
Right. And what's so tricky about that is you're trying to do that not watching one variable, but watching countless variables, most of which are invisible, all of which interact, and they change constantly, and you're supposed to figure it out.
Well, it does change over time. It does change with whatever age you're at. And there are real variables here. And our responsibility is to be conscious enough to go with the variables according to age and situation. There's not a rote thing. You can't read it from a book. You have to think about it.
Yeah, there's not an ideal program for life that you just have to do whatever it says.
Yeah.
You got to be in touch with your body and spirit and the whole thing.
That's right.
Shouldn't be a problem. We should be able to do that. But
people realize that that's their part of their life responsibility. One of the advantages of spiritual fasting is you start to tune in to the fact, oh, wait, I'm responsible. I need to figure out how to best live to make it work.
So what do you think about the idea that if we find the normal, or I'll be more positive about that. When we find the normal of everything, then we're designed to stay in incredible condition for our lifetime, and then just leave when we're done with the lessons here.
Well, totally agree, but I'm not going to use the word normal anymore. I think you made the point, optimal.
Optimal, sorry. Okay.
Do you see what I mean?
Yes.
Up to the time of Jacob, historically, Abraham, Yitzhak, they were and Moshe too, were in perfect health, and they just left their body.
That sounds optimal and normal.
Right.
Yeah.
So Jacob is the only one who was a little sick at the end, but the concept, the biblical concept is you're in perfect health till it's time to leave your body. Then you leave your body.
Yeah. Intuitively, that sounds right to me.
Yeah. So
if that's not happening, then it's our job to find out where are we veering off what we're supposed to do.
That's right. So that's my model. It's like, fine, just be in optimal health. I don't care. Just be in optimal health. Do whatever it takes. Be there. And that's the quote norm, but I will call it optimized.
Yeah. And then the question with that, and I'm not going to keep you too long. I know it's getting late over there, and we could talk for a long time. But
long time. We love to talk. That's you and I.
Well, following this quest for the real norm,
right?
The advantage of doing that and putting it into practice the best you can, in the midst of when you discover you're living in a a world that's basically, to call it a mental hospital would be an insult to mental hospitals at the moment, probably. This is a way that you can also have a healing effect on the rest of the world at the same time, right?
As we increase our vibration, the vibration of the global mind also increases. Yes.
So we're changing the energetic atmosphere of the planet.
Absolutely. Absolutely. The more people that meditate and get back to a optimal lifestyle, the better it is for the whole planet.
Yeah. So that gives us something to work on until we get to talk to you again.
Yeah.
Which we're actually working on together.
Yeah. It's always a joy to talk to you and to do these interviews. So this is perfect.
Okay.
Thank you, Doctor.
Thank you, Doug. And thank you so much. It's fun to work with both of you. Keep up the good work.
Same here.
Both, okay?
Yeah, exactly. Things will be better and better. So have a good night, both of you guys.
Yep.
Take blessings to everyone.
Bye-bye.
Goodbye. Shalom, shalom.